party political campaign that has been fighting to keep an acute accident and emergency and acute services in Hammersmith and Fulham for, it feels like forever, but I think it's been about 2 years now. The actual situation at the moment is Hammersmith and Central Middlesex accident emergencies, as part of shaping our healthy future plans, are threatened with very imminent closure, probably at the end of the summer, although that's not quite clear yet. When the results of the independent refiguration panel were announced, Jeremy Hunt said that more work needed to be done before Charing Cross and Ealing A&Es could close. Since then, that's proved to be rather a smokescreen because we have some clear evidence that services are being wound down in both areas. There's lots of controversy about what the proposals are, but what I don't think anybody will dispute is that what's proposed for Charing Cross is the loss of at least 300 acute beds, which will mean the loss of acute services in Charing Cross, the loss of any blue light accident and emergency service, which means that if you have an accident or emergency that requires a 999 ambulance, you will not be going to Charing Cross. What will also be lost is the backup of the intensive care unit and also the closure of the stroke unit at Charing Cross and its transfer to St Mary's. I think they are, I don't think anybody would argue with that summary of what's actually going, and that's what's at stake. We are really clear that the proposals together will affect 1.9 million people. We don't think you can close 4 casualties, lose 500 beds across northwest London and not have an impact. And we know that primary and community services will be struggling to cope. And that's why we're campaigning. My background is as a community nurse and community matron, so I'm very well aware of the need for good primary and community care services. I'm also very well aware that because of resource issues, it would be impossible for primary and community care to take up all the extra patients that would be required if these casualties close. I think that's a very broad, factual statement of where we're up to now. So what I'd like to do now is invite each of the candidates to give a 3-minute, and I'm going to be really strict on times to make sure the public can have a say as well, a 3-minute introduction to views about Charing Cross and about the local health service.